So I'm Sue Ott Rollins, and I am the Provost and Executive Vice President for Academic Affairs at Northern Kentucky University. So we have a College of Health Professions, and that houses most of our health-oriented programs. With the building of the new Health Innovation Center, we'll be able to expand those programs, and we'll be able to offer new ones that we don't currently have at NKU. One of the things that will be very unique about it is that we'll have a state-of-the-art simulation center. Simulation centers are very important because they actually provide the clinical nursing and other types of clinical students to work on a high-tech, high-def mannequin that breathes. It has fluids. It can exhibit symptoms. A student might be treating that mannequin, that patient, and suddenly the mannequin goes into cardiac arrest or something like that. And so it provides our students with real life simulated experiences. Right. So there's also going to be a simulation of an operating room. So we'll have that. We'll also have a space called a standardized patient suite. And that's where actual human beings, not the mannequins, take on the symptoms and the illnesses and role play as if they are real, actual patients with the clinical student. About that, we're really talking about the emphasis on active learning. So in the old days, we might have students listening to lectures, taking notes, doing tests, things like that. I think we all understand that human beings learn best when we're actually doing things, right? So it's one thing to give me the information. It's another thing to let me apply that information in a real life setting. So what we've found in college teaching is that the more we can engage students in their own learning. So it might be learning in groups, doing group projects. It might be making more presentations. So it's not passively sitting in the chair. So we want our students from the very beginning to feel like they're helping to direct their own learning.